I want to welcome all of you for joining us tonight. I'm thrilled that you're here, and I am going to keep my comments hopefully to under 15 minutes because we want to keep the majority of this hour open for your questions and our frank responses. So my goal in the next 15 minutes is to discuss new information that's really come out in the past couple of months about the safety and the effectiveness of the COVID-19 vaccines. And I'm really going to just be concentrating on the efficacy and safety pertaining to children, because the children and adolescent group are the groups that were approved for the vaccine or authorized to receive the vaccine most recently, and we haven't had as much time to vaccinate this population. So I really want to focus in on our children. I want to share updates on the vaccine effectiveness in adolescents, and when I refer to adolescents, I'm referring to the ages 12 through 17 years, and very recent published data on the efficacy of the vaccines in reducing COVID infection. And perhaps most importantly, what really is meaningful is in preventing hospitalizations, critical illness, and death. And then a very recent publication on preventing a very dreaded complication of COVID in children, referred to as multi-system inflammatory syndrome, or MIS-C. This is a dreaded complication. It's a post-infectious inflammatory condition that can literally affect any organ system of the body. And it can affect the heart, the lungs, the skin, the GI tract. And it really is a dreaded complication. And we do not want to see this occur in any of our children. And then lastly, I want to update you on the very recent eligibility criteria for adolescents and children, since some of these recommendations are very new and you may not be familiar with them. So it's just some general comments about children and COVID. In general, COVID disease is much milder in children, although severe disease and long-term complications sadly can occur. And according to the American Academy of Pediatrics, we have had in this country over 8.5 million cases of COVID to date and almost 750 deaths. And that is unfortunate. We do need to collect more data on the impact of COVID in terms of the different variants. We know that during Delta, particularly in September, there was a marked increase in hospitalizations for children due to COVID. And we will learn with Omicron the impact of hospitalizations, but we feel that that is less likely, but we're early in this process and we're still learning. We know that there have been some long-term physical complications in infected children, referred to as long COVID, where they continue to have ongoing symptoms, inability to concentrate, and some cognitive disorders. And that clearly requires further study. And we all know, we've experienced this over the past 2 years, the profound impact this pandemic has had on our children's mental and emotional health. And that is going to take us a while to recover from. But if we need to do everything we possibly can to normalize our kids' lives and to get them back in school where they could stay in school, get them back into their social activities and into their sports programs. So this was a very recent study that was published in the New England Journal of Medicine. It just came out, and it described the clinical trial for the COVID vaccine in children 5 through 11 years old. And the bottom line is this vaccine was very effective, more than 90% effective at preventing symptomatic COVID disease in children. And equally, and perhaps more important to parents, is the efficacy that this study demonstrated. It was very safe. This next slide demonstrates side effects. And if we concentrate in on this upper panel here, those are the local side effects that children who receive the vaccine or receive the placebo. The placebo is basically sterile salt that children are injected with. And for local side effects, after the first dose, on the left side of this upper panel, we see that local side effects, specifically pain at the injection site, was common in almost 3/4 of the children who received the first dose. But notice that even in children who receive a placebo shot, they have pain at the injection site. Overall, the green demonstrates that most of these symptoms were very mild. The blue demonstrates moderate. None were severe. Following the second dose, there was about the same amount of pain at the injection site in the children who received the placebo. Other reported side effects that occurred included redness and swelling at the injection site, but these were very low. On the bottom part of this slide, these are the systemic side effects that the children experienced. After the first dose, the most commonly reported side effects were fatigue. This is the vaccine group, and this is the placebo group. And really, there's no difference here in terms of fatigue after the first dose. After the second dose, there was a little bit more fatigue, notably in the vaccine recipients. And then the second most common reported systemic event in our vaccinated patients was headache. But again, headache was not that uncommon. And in fact, there was no difference after the first dose in the patients who received the vaccine versus the placebo. After the second dose, there was a little bit more headache noted in the vaccine recipients. Other side effects like fever and chills were very uncommon. And I want to emphasize there were no reported cases of myocarditis, that's heart inflammation, that we have seen in some adolescent males predominantly in the adolescent vaccine trials. But in this clinical trial, in the younger population, there was no reports of myocarditis, pericarditis, or anaphylaxis. Anaphylaxis is a serious allergic reaction. Now I'm going to share with you a lot more information about the safety of the vaccine in children. And this is data that was reported the last day of December in 2021, looking at two safety monitoring systems. One's referred to as the Vaccine Adverse Event Reporting System, or VAERS, and the other system is the vSafe system. That is the cell phone-based system where parents could provide feedback to CDC and FDA on their children's experience after the vaccine. They get pinged daily for the first 7 days if they agree to participate in this program. And then they are pinged less often over the course of the next several weeks, and then quarterly over the course of the first year to identify any type of unanticipated adverse reaction. And looking at both monitoring systems, both the VAERS and the vSafe app, after over 8.5 million vaccine doses in our children, they demonstrated that the side effects were mild. There were a few cases in this 8.5 million population of myocarditis, but all children had recovered or were in the process of recovering. And pain, as we discussed in the clinical trial, fatigue, and headache were the most common reported side effects, and they were mild and brief. So what should you expect if your child is vaccinated with the COVID vaccine? And there's only one vaccine authorized for children right now. It's the Pfizer BioNTech vaccine. You should expect that 1 out of 20 children will be unable to perform their normal activities on the day after they receive their first dose. So they may not feel up to going to school or participating in their normal activities. These side effects are short-lived, and after a day, most kids are back to normal. After the second dose, you should expect a little bit more in the way of a child not feeling up to par. 1 out of 14 children will experience some interruption in their daily activities after dose 2. Local and systemic side effects after the vaccine are more common after the second dose, but as I demonstrated in the clinical trial, are mild and generally short-lived. Now let's turn our attention to our adolescents, our kids that are between 12 and 17. This was another publication from that was in the Morbidity and Mortality Weekly Report, published the last day of December of 2021. And it demonstrated in adolescents, the Pfizer vaccine was 92% effective at preventing infection. That's remarkable. And that builds on a prior study that is summarized on the right of this slide, looking at adolescents, that demonstrated a 93% reduction in hospitalizations among vaccinated adolescents. And among hospitalized adolescents, it reported that 97% were unvaccinated. And no vaccinated adolescents that were hospitalized required intensive care unit admission. Another report, the first week of January, out of Morbidity and Mortality, looked at the ability of the vaccines to prevent multi-system inflammatory syndrome, or MIS-C, the dreaded complication that I discussed earlier. And it demonstrated that the Pfizer vaccine was 91% effective at reducing the risk for this dreaded complication. And when they looked at patients that were hospitalized with MIS-C, 95% were unvaccinated. And no vaccinated patients that developed MIS-C, the very small number, required life support. And then even a more recent publication in the New England Journal of Medicine, looking at the effectiveness of the Pfizer vaccine against critical illness in adolescents. And it demonstrated 94% effectiveness at preventing hospitalization, 98% effectiveness at preventing intensive care unit admission and life support, and 100% effective at preventing death. All 7 deaths that occurred in this report were in unvaccinated adolescents. So what are some updates that I'd like to share with you regarding adolescent vaccination? We know now that boosters are very effective at helping to broaden our immune response and strengthen protection against the Omicron variant. So it's very important for our adolescents to get vaccinated and then to be boosted. And CDC just recently expanded eligibility for our adolescents 12 through 15, 17 and 16 through 18 were already authorized to be boosted, but now it includes 12 through 15-year-old adolescents. And this was based on a very careful review of safety data after 25 million doses had been administered to this age group. And they concluded that vaccines are safe and effective, and in order to provide added benefit against variants, they are now recommending that our adolescent children get boosted. Another report that was recently published, this is probably the most recent publication, looking at the association of newly diagnosed diabetes mellitus more than 1 month after COVID infection among children. And this looked at 2 large commercial health systems and looked at claims, and it identified that children that had a COVID infection were more than 2.5 times more likely to be diagnosed with diabetes. That is really unfortunate because diabetes is a lifelong diagnosis that requires lifelong treatment and unfortunately is associated with a lot of complications. So vaccination is a way to prevent yet another dreaded complication of COVID in our children, and clearly highlights the importance of vaccination. So where are we at Cambridge Health Alliance? We have an opportunity to do better, although we are doing reasonably well. Among our adolescent patients that we care for at CHA, 42% have been fully vaccinated, meaning they've received 2 Pfizer doses, and an additional 5% have been boosted. So we are above the national average for our adolescent population. For our younger children, age 5 through 11, we have fully vaccinated, about a quarter of our population. So we have an opportunity to do better there. And I hope that for some of you who have questions around your children, and if you're on the fence, we will get to those and address those later on. So my recommendations for our children and next best steps is to vaccinate all our kids that are 5 through 17 years of age, and to boost our adolescents 5 months after they completed their primary series. So this is another recent change. Previously, boosting followed 6 months after the second dose. It has now been reduced to 5 months. And CDC also recommends a third dose for certain immunocompromised children who are in the 5 through 11 age group. So with that, I hope I provided to each of you some more information to convince you that these vaccines are safe and are effective.